Hi guys, in today's video we'll be discussing difference between Caput Succedaneum and Cephalohematoma. We'll be using these pictures to differentiate them, the definition, the time of occurrence, the increase in size, the outcome, the pitting factor, and the treatment. So let's define them. Caput Succedaneum now is the accumulation of fluid under the periosteum, while cephalohematoma is the swelling in the head of the newborn due to the collection of blood from the damaged capillaries under the periosteum of the cranial bone. This one is obara or ẹ̀jẹ̀. Why this one now is fluid? Okay, let's just use a layman's language. This one now is water inside the periosteum. Why this one is obara for my Yorubas or ẹ̀jẹ̀, which is caused by the damaged capillary under the periosteum of the cranial bone. The time of occurrence in Caput Succedaneum, it is present at birth, but in cephalohematoma, it is dictated after 24 hours of life. So let's go to increase in size. This Caput Succedaneum now does not intend to enlarge. It do not enlarge, but this cephalohematoma now may increase in size. So the outcome now, Caput Succedaneum can cross a skull bone suture line. There is difference between increment in size and crossing. If a capillary is damaged, it tends to increase because there is bleeding. But if it's water, the water spreads. But this one now do not cross. It cannot cross. Swelling is confined to the affected bone. Okay, the pitting factor now. Caput Succedaneum can pit under pressure or in edema. If you touch it, it's going to pit. It will enter inside. That is what I mean by pitting. It will enter inside. If you press it, it will enter inside. But this one now, it do not pit under pressure because this thing is strong. Like, have you hit your hand on something? The place will now be very hard. If you press it, you cannot press down. Treatment now, it is usually resolved by 36 hours. That is 2.5 days. But this one now, it does not resolve without treatment. It can disappear spontaneously at 2 to 3 weeks. But in all this now, you have to tell the woman, you have to reassure the mother that the swelling will not interfere with the normal development of the baby. You get? So that is all for the difference between Caput Succedaneum and cephalohematoma.